Hello, my name is Gerry McElvaney. I'm the head of the School of Medicine in RCSI, and I would like to take this opportunity to welcome you to the Undergraduate Open Day for 2022-2023. One of the questions people often ask is, why do medicine? Well, I can answer that to an extent. I find it a very rewarding career, and it gives us all an opportunity to make a genuine difference to people's lives. No doubt that medicine graduates are in very high demand around the world. And one of the most attractive things about medicine is that the career paths are very diverse. You can work in hospitals as a surgeon or a physician or in radiology. You can work in community medicine and family practice. You can also work in public health, and that's been really important, for example, during the COVID pandemic. You can also work in academia, in research, in industry. There's a whole range of other options. So in reality, medical degrees are a career passport with a wide application. Why pick RCSI? RCSI is unique. It's a specialist health sciences university. It's had a lot of external validation. More recently, it's been voted one of the top 250 universities in the world. It's in the world top 50 for good health and well-being. With regards to research, our research citation impact is the highest in Ireland and twice the world average. We've been a national provider of surgical training since 1784. We also provide training in radiology, sports and exercise medicine, dentistry, nursing and midwifery, as well as undergraduate medicine. Why study in RCSI? It's the largest medical school in Ireland with over 1,800 medical students. It's an international medical school. Our student community has more than 60 nationalities. It is a global reach. We have 28,000 or more medical graduates in almost 100 countries. And we offer a diverse opportunity for medical students. We have 4-year, 5-year, and 6-year programs for school leavers, graduates, and mature students. With regards to CAO entry, the cost of attendance to RCSI is the same as all other medical schools in Ireland for Irish and EU students. We have world-class facilities, and they're getting better. We have invested over 100 million euros in facilities since 2017, and we plan to invest another 90 million by 2025. We teach early clinical skills using Europe's most advanced clinical skills simulation facility. It's absolutely fantastic. It's the home to a fully equipped mock operating theatre, hospital rooms, clinical task training rooms. We've got high fidelity clinical simulators. They can breathe, they can blink, they can even give birth. We can prepare you for practice via safe, repeatable and structured models. All our sessions are recorded and the students can watch them at their leisure and see how well or how poorly they performed. This is the modern way of teaching. There are also many research opportunities in RCSI. We have a student-selected research projects. We have research summer schools. We have a student medical journal which publishes our research. We have funded research electives throughout the world. We have an annual research day. And our students are at the forefront in organising an international conference for medicine and healthcare students. We advocate and encourage overseas clinical electives. We want our students to see how things are done elsewhere, to compare and contrast, and to realise that not everything done abroad is better than at home, but there are lessons to be learned. We promote clinical observerships in the earlier years. We promote medical volunteering opportunities, for example, with the Christina Noble Foundation or Floating Doctors. We're also very, very eager for our students to participate in international clinical electives at prestigious North American institutions, such as Yale, Mayo Clinic, and Johns Hopkins. Having such a large global alumni network gives us enormous opportunities for our students to go to other countries and learn best practices. We have a new and evolving curriculum. Our curriculum is one of the most modern in Ireland for teaching medicine. It's innovative and future focused. We are very much advocates of small group teaching. We can track your academic progress in real time using a dedicated e-portfolio system. We have a personal tutor program, and we can give the students personalized feedbacks on assessments, case-based learning, and other learning activities. With regards to assessment, we've taken enormous efforts to make sure it's fair and it's programmatic. So students have multiple opportunities to measure their progress, and we've tried to reduce emphasis on large end-of-year exams. We encourage learning communities. We encourage groups of students to actively engage in learning together. We do case-based learning, clinical skills learning, various anatomy practicals, etc. In addition, in recognition of the changing healthcare situation, we are very much advocates of interprofessional education. Our education is part of a broader interprofessional learning experience made up of medicine, pharmacy, and physiotherapy students. So let's briefly go through the various years. Some students enter the 6-year medicine track, and this involves a foundation year. Foundation year is important as it gives a solid grounding in the biomedical sciences, communication, professionalism, and IT skills to those students who may not have had as much of a background in that as some of their peers. So it enables students to learn and catch up. In semester 1, they'll be taught the fundamentals of medical physics, medicinal and pharmaceutical chemistry, and human biology. And then, when they get up under their belt, they'll move to semester 2, where they'll learn about disease diagnostics and therapeutics, and medicinal and pharmaceutical chemistry as it pertains to clinical scenarios. In both these semesters, there'll be a large emphasis on clinical problems. They'll be taught about the musculoskeletal system, the nervous system, cardiovascular and respiratory. They'll be taught all these things that are important in diagnosing and treating patients. But inculcated in all this is professionalism in health sciences. They'll be taught what is expected of the modern doctor. And also they'll be taught how to interpret laboratory data. And this data interpretation will be managed during the biomedical laboratory sciences part of their teaching. So having finished the foundation year, these students can then move into first year, Medical 1. But also 5-year students in that program can go directly into Medicine 1. In Medicine 1, you will learn basic anatomy, molecular and biochemical basis. You'll be taught the principles of pharmacology, microbiology, and pathology, and develop an understanding of epidemiology and the mechanisms of disease. We will again emphasize a deep knowledge of musculoskeletal and skin systems, and we will teach you how to diagnose and manage common, important cardiovascular and respiratory disorders. Inbuilt in all this, you have certain student choice modules, so you can follow an area of particular interest to yourself. We believe in case-based learning. It's a key learning tool in year 1, which will focus on building knowledge through group work. And this is a preparation for your career as a physician or surgeon, where you'll be required to work seamlessly in a group setting. So in semester 1, you get the foundations for practice. You learn about the body, movement and function. Semester 2, you learn about the cardiovascular system. You learn about the respiratory system. And then you move on to second year. In second med, you gain knowledge and skills. You'll be taught how to communicate effectively, to work professionally and collaboratively. And then we'll go back again to more systems. You'll be taught about gastroenterology, hepatology, the central nervous system, the endocrine system, renal and male genital urinary diseases. And you'll learn a lot about an evidence-based approach, which is grounded not only in best practice, but in safe patient care. You will again get student choice modules. So there are a lot of modules which you can choose to do, which may be of particular interest to you. So you may wish to do a module on the innovations in research or global health or health systems, and we'll facilitate that. This year, you'll also have a preparation for your clinical attachment module, because that will teach you how to navigate the hospital environment, prior to your clinical placements in Medicine 3. In Medicine 3, the class will be split into smaller groups, and here you'll undertake prescribed modules at different times throughout the year. Most important, you participate in hospital-based clinical placements, and there you will apply the knowledge you've gained in the previous years to real patients in a variety of healthcare settings. So now you'll be meeting patients on a one-to-one basis. We'll have simulation modules and New Horizon modules, which will provide you with a framework to interact and engage with the new technologies which are so important in modern medicine. And again, you can do student-selected research projects which can be completed overseas. But the real attraction to Year 3 for all our students is now they can put in practice what they've learned in previous years and hopefully see that that can benefit in real time patients on the wards and in the community. In Year 4, you're now into the senior cycle. And in this cycle, the students are anchored full-time within a clinical team at an RCSI affiliated hospital. It's a busy year, but it's really, really interesting. We'll do clinical rotations through medicine and surgery, obstetrics and gynecology, psychiatry, pediatrics and child health, and general practice. You will practice your clinical skills and take an active role in the care pathways of individual patients in a whole variety of healthcare settings. And throughout all this, you'll continue to develop your knowledge and skills in professionalism, communication, leadership, global outlook, and clinical competence. So this is a very busy year, but our students tell us it's one of the most rewarding years, because now you're getting to see a wide spectrum of medicine in its broadest sense. And then we come to the final year, and this is a tough year for most students, but it's one in which they see light at the end of the tunnel. You're now within a year of qualifying as a doctor. This year represents your final preparation for practice toward becoming a working clinician. In this year, students take the final clinical placements before graduation. They have 2 clinical clerkship modules. They can be completed in any clinical discipline, although at least one must be in an acute hospital in the form of a sub-internship. RCSI pioneered the sub-internship in Ireland. It was classically used in North America. It really prepares you for your first year as an intern. We also have student elective options that are available outside of Ireland. But the preparation for practice module, the sub-I, is a very comprehensive method which will allow you to demonstrate your ability to communicate effectively, professionally, to develop your skills, to manage challenging clinical scenarios as part of a team. And it really does give you a taste of what being a doctor is in the healthcare setting presently in Ireland. So in this year, you're all set and you're trained to take your place as a functioning doctor. Our doctors come from all over the world and they do diverse things. You can see this is a small snapshot of some of our alumni. Some have done work in neurosurgery, some have worked in obstetrics and gynecology, others have sought a humanitarian organization to work in. But the point to make is they're a diverse group with diverse ambitions. But I think the one thing that's striking when talking to them all is they've learned their trade in RCSI. They've been taught basic medicine and surgery in RCSI. And in addition to that, they've been able to sample all the major specialties and determine what they want to do in life. We also think we've inculcated in them the wish for lifelong learning and realization that medicine is a constantly evolving subject which requires that application. And their success really is a testament to how well RCSI does that. So that's a brief introduction to the RCSI Medical School. I think it's one of the best in the world. I think those who come to it do very well, not just in the 5 or 6 years they spend with us, but also when they proceed from our hospitals and lecture rooms to work in the real world. If you have any questions, we're hosting a number of events later today, including a HPAT presentation and question and answer session, a medicine students panel discussion, and an admissions Q&A session as well. So again, thank you for your attention, and I hope to see you all, or many of you, fairly soon in the coming years. Thank you very much.